Therapy Corner. Here at the Therapy Corner, what we try to do is educate, demystify, enlighten on all things psychological in nature. That includes therapy, counseling, and research. And today we have a very special guest. We have Deborah Bayles, who has such a resume, it would take me probably the entire show to go through it. She's a very impressive lady. She currently is working as a associate marriage and family therapist for the Center for Human Understanding and Growth. She does also teach currently and does many other things. She has spent over 2 decades in marketing, education, and technology management. She has authored 2 best-selling ebooks and numerous papers and articles. She founded NE Touch Communications, Inc., which was one of the first ISPs out there. She co-developed the e-business certificate curriculum at the University of Irvine. So this is a very, very impressive lady, very knowledgeable, and she's going to talk to us today about ACEs. And we're not playing cards here, folks. This is ACEs, A-C-E apostrophe S, okay? And this is the adverse childhood experiences. So, Deborah, welcome to the show.
Thanks, Ole. Well, for this presentation, what I'd like to do is go ahead and share my screen with the PowerPoint. Yeah, what I'm most interested in for our meeting today is to really get people acquainted with what ACEs are. And ACEs are basically adverse childhood experiences of, abuse, neglect, family dysfunction, et cetera, before the age of 18. And the reason why ACEs are actually addressed and measured is because the brain, of course, develops before the age of 18, actually primarily before the age of 3. And any kind of adverse childhood experience can disrupt the development of social, emotional, and cognitive functioning. So an adverse childhood experience can be really any highly stressful experience that can happen before we turn 18. And of course, since we're children, ACEs are not our fault, and because we just didn't have control over what, why, or when they happened. And it can be something like a single event, or it can be a series of horrific events during our childhood, and they really affect our ability to really cope with our safety, security, trust, even our sense of self. What's really interesting is that adverse childhood experiences have an extreme impact later on in life and are really the leading cause of 10 of our most severe health outcomes. Basically, the ACEs questionnaire is given to all my clients, and it is now being introduced nationwide and hopefully worldwide. And it's a 10-item questionnaire only, where it asks 10 basic questions. They're yes or no answers, and they cover 10 different areas of your childhood experience. And what I'll do is I will go ahead and just read you the ACEs questions. And so for those people that are following along with this, you can answer to yourself yes or no, and then just keep track of how many yeses that you answer to these things. So a yes answer is 1 point, and a no answer is 0 points. And so keep track of the number of points or yeses that you answered in these questions. So the first question is, while you were growing up during your first 18 years of life, did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you feel afraid that you might be physically hurt? So answer yes or no to that. If yes, enter 1. Second question. Did a parent or other adult in the household often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Once again, yes or no. Yes is 1 point. No is 0. Number 3. Did an adult or person at least 5 years older than you ever touch or fondle you or have you touch their body in a sexual way? Or attempt or actually have oral, anal, or vaginal intercourse with you? Once again, yes or no. Question 4. Did you often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, feel close to each other, or support each other? Once again, 1 point for yes, 0 points for no. 5. Did you often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? Or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? Yes or no? 6. Were your parents ever separated or divorced? 1 point for yes, 0 points for no. 7. Were any of your parents or other adult caregivers often pushed, grabbed, slapped, or had something thrown at them? Or sometimes or often kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over at least a few minutes or threatened with a gun or a knife? Once again, yes or no. Number 8, did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Yes or no. Number 9, was a household member depressed or mentally ill, or did a household member attempt suicide? 1 point for yes, 0 points for no. And our final question is, did a household member go to prison? Yes or no. So if you have yes, then you enter a 1. So those are the 10 basic questions, Oli. And if you add those up, that is your ACEs score. And
okay. So I feel like I didn't do too badly. I only got 4 out of 10.
Okay. Well, we'll keep that number in mind, Oli, because that ACEs score becomes very important as we talk later on about the effect of ACEs on your childhood development and your future diagnosis for health issues. You may not even remember a lot of these things, but your body keeps a score. And that's what's really important in this entire ACEs study. So interestingly, the history of this whole adverse childhood experiences study was actually started by an endocrinologist who ran a successful weight loss clinic for Kaiser Permanente. And he found out that most of his successful patients dropped out of the study or gained their weight back. So he interviewed them and found out a high percentage of these patients had abuse, household dysfunction, and neglect during childhood. And so he actually, gave everybody these questions, and the results were shocking to the point that he presented his findings to the Center for Disease Control. And this Robert Anda was very interested. So together, they set up a larger study, and they went through over 17,000 patients who filled out this questionnaire. And the average age of this population that they studied was 80% white, 10% African American, 10% Asian, and 51% of them were female, 49% male. 74% had some college, and 46% actually graduated college. So, a fairly educated group. And they found out that over 50% of this study group have at least one ACE. And ACEs are really uncommonly recognized, mainly because they are concealed by, the shame involved, secrecy, family secrets type of thing, social taboos, not to complain about it, or people just simply thinking, oh yeah, it's totally normal that I was, beaten with a belt. So they found out that ACEs are the strongest predictor of adult disease risk, and that a lot of these public health problems are actually solutions that people employ. They're coping mechanisms that people employ to help deal with this environment of adverse childhood experiences. So they're actually coping mechanisms or adaptations that we all use to help soothe ourselves and deal with those that traumatic stress that's caused by those traumatic memories. So here is like the mic drop. ACEs are implicated in the 10 leading causes of death in the U.S. And virtually every study shows that ACEs are a strong predictor of homelessness. The ACEs researcher was just absolutely shocked by this study, the results of the study. So what happens is, as our brain develops, the impacts because of these ACEs last over our lifetimes, and they end up with chronic disease, psychiatric disorders. So this adaptation we were talking to, this coping mechanism that we were talking about, is actually then hardwired into our body during the brain development phase. So you have impaired cognition, shows up in our work, school attendance and performance, obesity, alcohol, tobacco, drugs, risky sex, crime, poverty, and it's intergenerational. So in other words, a lot of my clients are wondering, well, that's just how my parents were treated. And so they treated me the same as they were treated. And so if you have a high number of ACEs, chances are your parents also had a high number of ACEs because they were simply reenacting the coping mechanisms that they learned as kids. And so when they raised their own children, they subjected them to the very same kinds of adverse childhood experiences that they received as a child.
Well, that goes along with when I confronted my father with the way we had been raised. His answer was, I didn't know any better.
Exactly. So when I administer this ACEs questionnaire to my clients, and every single one of them gets this questionnaire, they go, wow, I thought that was normal. When I start to take a look at it, yeah, these memories are starting to come back. I'm starting to realize that maybe I truly lived in Dysfunction Junction, and I didn't think it was all that bad because maybe.
Well, we didn't know any better, did we?
Yeah. And maybe, my extended family, everybody did the same thing.
Sure.
So at any rate, this kind of scary pyramid that we see on the slides here illustrates the mechanisms of dealing with these ACEs and actually set us up for diseases and for social and emotional and cognitive problems in our lifetime. And that's actually what brings most people into therapy, is the trauma that is caused by having these ACEs. So here we go. Oli, you had 4 ACEs. You're 2.2 times likely to have ischemic heart disease.
Yep.
4 times likely to have a stroke.
Runs in the family.
1.9 times as likely to have cancer. 1.6 times as likely to have diabetes. So
no.
Okay. Yeah, so you can imagine that the higher your ACEs score, they found out that it's actually like a dose-response relationship. So if you're up here in the 4+ ACEs, you're up there with 45% of the population that are having health problems. Greater than 5 ACEs, and you're really setting yourself up for a lifetime of emotional and physical issues. So here are some of the top 10 risk factors for chronic illness and death. And all of those are directly related to the trauma and the coping mechanisms that are created by trying to adapt to a high ACEs score. And as was mentioned earlier, it's a indication of a high rate of homelessness. So once again, the adaptation to toxic stress. And the toxic stress, of course, as we know, is the fight-flight response to being constantly vigilant growing up with a history of ACEs. So if you were in a dysfunctional household where you were constantly waiting for the other shoe to drop, constantly scanning the environment for wondering if somebody was going to blow up or explode or get hit, upside the head or something, then that toxic stress builds up and keeps its score in the way that you adapt. So as your brain is developing, it's affecting your cognition, your attention, your behavior. Your brain actually wires itself to be in this constant state of alertness and fight or flight. And it ripples through to how you grow up and your productivity. So worker performance, if you've got a high ACE score, that generates a lot of the issues in the work scenario. They found out that over half the children in the U.S. are exposed to violence, crime, and abuse every year. And if you're not exposed, you'll witness it or experience it yourself. And over a quarter of kids experience this before the age of 4. That's pretty frightening. Going on, this causes a tremendous impact in the amount of money that we spent on problems. As you could attest, and I can certainly attest, with COVID and the stresses with what's going on in the world, the office at Center of Human Understanding and Growth is being inundated with phone calls. I'm certainly getting inundated with phone calls, referrals by Psychology Today wanting therapy for anxiety and depression. This is all the ACEs that are kind of activating and coming out. So trauma is an epidemic in 60% of adults, 50% of children. It affects almost universal in boys and girls in the juvenile justice system, and increases the risk of further trauma. So in the court system, this is interesting. 70% of women were in foster care as children and have an ACE score of 5 or more. 23% of women who were in the foster care system as children have an ACE score of 9, and that is incredibly high. So this is telling you a lot about how the foster system operates. 48% of male offenders in criminal court had an ACE score of 4 or more, as compared to the general population. So you might be in the general population and have a score of 4, but in the criminal court, definitely there was a correlation there. So school performance, of course, is drastically impacted by ACEs. Children with 3 or more ACEs are nearly 4 times more likely to have developmental delays and 32 times more likely to have behavior problems in school. And of course, school performance along with other childhood conditions are just rife with kids that have these high ACEs score. So you can see that all across the board, how you were raised as a child and what you went through has profound and lasting effects throughout your life. And this is where later on, if you don't treat the trauma, if you don't go to therapy and try to ameliorate the impact of these ACEs, you are setting yourself up for a lifetime of some really serious problems. So what happens is you're basically hardwired as a kid that goes through these ACEs, that your viewpoint of the world is changed to the point that traumatized kids believe that the world is, punitive, judgmental, humiliating, blaming. All of my clients have what's called a negative cognitive belief, a core belief that they are unworthy, that they shouldn't be alive, that their parents didn't want them, they're not enough. And these negative cognitions are caused directly by these ACEs. Kids also start to believe that control is external, and they don't get that internal locus of control. that people are unpredictable and trustworthy. They want to defend themselves above all else, and they believe that admitting mistakes is worse than telling the truth. And you can kind of see that in today's political environment even. So we can see children with ACEs have a much greater percentage of smoking, huge percentage of adult alcoholism. I don't know anybody who comes to me with substance abuse disorders that hasn't had a high ACEs. And, you know, of course, they're drinking to anesthetize those traumas, the constant feelings that they're getting, that general anxiety. Chronic depression is huge, especially in a higher degree with women who, my female patients, without exception, who have a high ACEs score, have a very high level of chronic depression, generalized anxiety disorder, and a really high degree of codependency. So they are raised often to take the role of the parent to their own parent. They often have the parents coming and crying on their shoulder as kids about how terrible their father is, or they're oftentimes beaten by their father, the parents, and the daughters. The daughters are having to take on the role of the female parent. So there's a lot of kind of emotional incest that goes on in these dysfunctional families. And meanwhile, the boys are raised with toxic masculinity, and there becomes this splitting between gender roles, and it becomes very rigid, and it sets up both men and women later on to enact a lot of these dynamics out in their marriages and in their families. Suicide. Childhood experiences underlie a large portion of suicidal ideation. Intravenous drug use, of course, once again. Serious job problems. That is definitely a problem with ACEs. So all in all, one of the best quotes I've found, Oli, is by Alice Miller, who wrote, of course, the landmark book called The Drama of the Gifted Child. She says, the truth about childhood is stored up in our bodies and lives in the depths of our souls. Our intellect can be deceived. Our feelings can be numbed and manipulated. Our perceptions shamed and confused. Our bodies tricked with medication. But our soul never forgets. And because we are one whole soul in one body, someday our body will present its bill. So,
amen.
Yeah, amen. So if you have listened to this presentation and you have mentally kept score of your own ACEs, the best thing you can do is go out to a website called ACEs Aware, because there's a nationwide study and support effort underway to help people address their ACEs score. And Nadine Burke-Harris has a wonderful talk on TED about ACEs, and she's the Surgeon General for the state of California. Mm. And they've started this acesaware.org website. Go out and take a look at it. There's also a website called Number Story, where it asks you, what is your number? What is your ACEs score, your number? And how are you going to deal with that? And ACEsawareVenturaCounty.org has some great webinars and trainings on ACEs. And then I've listed some other great links down here too, in some of the reference material that I used for this slide presentation. But one of the things, and I know with the Center of Human Understanding and Growth that we're trying to accomplish, is to really address ACEs, and every therapist can go through an ACEs Aware training and become certified using the acesaware.org website. And the training is a little over 2 hours. You can take it, it's self-paced, it's totally online. And our aim, I think, Oli, which we've talked about, is to make every one of our therapists certified as ACEs Aware. And since we're going to be dealing a lot through Chug with parenting skills and dealing with stopping some of these adverse experiences by parent education. This is where ACEs are where the whole administration of the ACEs questionnaire becomes really, really important in our work. And of course, when clients come in to us, we're doing things like trauma-informed therapy. I use EMDR, of course, CBT, and addressing some of the cognitive distortions that we all grow up with, being in ACEs-loaded childhood environment. That all comes to play in helping to heal ourselves from these traumatic events. Here are some of the other reference materials on the ACEs study. But one of the things that I really want to emphasize, Oli, is that there is a way out. We can address this, our own ACEs childhood experiences. And I've in my clients, only met one person that has 0 ACEs.
Thank you for watching today's episode, and thank you again, Deborah Bayles, for this very enlightening and educational segment. There will be a follow-up segment with another therapist who will take it in a slightly different direction. And so I hope you will tune in again and watch that as well. So again, thank you, Deborah Bayles, and you all stay safe, take care of yourselves, and be healthy.